Hi guys, my name is Niyati and welcome to this Chegg video tutorial. I'm a tutor here on Chegg Tutors and I mostly tutor biology and medicine related topics. And today I'm going to talk to you about the signs and symptoms of carpal tunnel syndrome. So in my previous video, I already spoke about what carpal tunnel syndrome is. It's basically the compression of the median nerve as it passes through the carpal tunnel underneath the flexor retinaculum. And the flexor retinaculum is basically a fibrous sheath that goes over your carpal bones along the anterior surface of your wrist. While the median nerve is passing through here, it can get compressed, and that is what causes the signs and symptoms of carpal tunnel syndrome. Now, in this video, let's look at what the signs and symptoms of carpal tunnel are, basically the clinical features of CTS. So, looking at the symptoms first. So the common symptoms or the typical symptoms of CTS is tingling, numbness, and pain and paresthesias that occur along the distribution of the median nerve. So that includes the thumb, the index finger, the middle finger, and the radial half of your ring finger. So basically the thumb, the first two digits, and the radial half of the third digit. So this is your distribution of the median nerve, and this is typically the area of the hand that is affected in a person who has carpal tunnel syndrome. And the pain most commonly occurs at night, and it can sometimes radiate proximally to the forearm. So proximally means it's coming closer to the body. So the pain can sometimes radiate to the forearm, and this is the typical distribution of the pain. As per the median nerve distribution. So it's the common way to remember it is the first 3.5 digits is what is affected on the palmar aspect. So going on to the signs. So the difference between signs and symptoms basically is, just to recap a little bit, symptoms are what the patient complains of, and signs are things that the physician is going to elicit on physical exam. So the symptoms of carpal tunnel syndrome is what we have just spoken about, and the signs are what the doctor tries to look for. So one of them is Fallon sign, and Fallon sign is when the pain and numbness comes back after a minute of flexing the wrist completely at 90 degrees for about a minute. So as you can see in the picture, the patient is instructed to completely flex the wrist at 90 degrees, as you can see. And after about a minute or so, typically in a Fallon's positive Fallon sign, the patient will start complaining of pain and tingling and numbness. Tinel sign is another sign, and if this sign is positive, how to elicit this sign, first of all, is to tap on the wrist, and the tapping is going to reproduce the symptoms of CTS, which is again pain and tingling. And if that happens, that's basically a positive Tinel sign. And another thing to look for on exam of the hands in a patient with CTS is atrophy of the thenar eminence. So the thenar eminence is the sort of pad of muscle that is at the base of the thumb. So this right here is the thenar eminence, as you can see in the picture as well. And in the picture, the hand on the left has a normal thenar eminence, as you can see right here, which is this bulge of muscle. And this hand over here has an atrophied thenar eminence. So it's not as prominent, it's not as sort of bulky with muscle. So that is another physical sign of carpal tunnel syndrome that you can look for. So just to go over and recap, symptoms include pain, numbness, tingling, and paresthesias, typically in the first 3.5 digits on the palmar aspect, which is along the distribution of the median nerve. The pain occurs at night, sometimes waking up the patients from sleep, because they say that they feel sort of a strained sensation in their hands. And also the pain can radiate proximally to the arm as well. Coming to signs, you have the Fallon sign, which is onset of tingling and numbness after telling the patient to completely flex the wrists at 90 degrees as shown in the picture. Tinel sign positive means that the pain is brought back up after tapping the median nerve at the wrist. And another thing to look for is atrophy of the inner eminence. So these are just a couple of signs and symptoms of CTS. I hope you enjoyed this video. In my next video, I'm going to be talking to you about how to diagnose carpal tunnel syndrome and subsequently the treatment as well. So thank you so much for watching. The link to my tutor profile is down below if you have any more questions. And see you in another video, and have a great rest of the day. Bye!